Good afternoon, everyone. This is Suzanne Mackey. We are about to get started. So welcome to our webinar, New Federal School-Based Health Center Legislation, What's in it, and How Can You Advocate for it? So before we get started, I do just want to go through some housekeeping issues and reminders. So all attendees are in listen-only mode until the Q&A session. This session is being recorded and will be posted online. We do want to hear your questions. So to ask a question during the presentation, please use the chat tool that appears on the bottom right side of your control panel. Participants will be unmuted for the Q&A session. So hi everyone, my name is Suzanne Mackey. I am Senior Policy Analyst with the School-Based Health Alliance. I am joined today by my colleague Kyle Taylor, who is Communications Manager with the School-Based Health Alliance. Many of you may also be familiar with our longtime policy and advocacy consultants, Brooke Lehman and Megan Zuckerman of Capital Works. Brooke, Megan, and I have worked very closely on developing and drafting this bill, and they are on the webinar today to help answer any questions. During this webinar, I will provide an overview of the bill and walk through each section a little further in detail. I want to make sure we have enough time for questions at the end, so I won't go too far in detail into each section. We have created a detailed section-by-section analysis that we will post to the website shortly. Kyle will walk through some of our advocacy tools and ways to engage the field in this process. So this new bill will be titled the Hallways to Health Act. This may sound familiar to many of you who know Hallways to Health as an initiative of the School-Based Health Alliance. We proposed this idea to Senator Stabenow's staff, and they loved it. This bill is a comprehensive bill designed to strengthen and expand school-based health centers across the country, helping to achieve the goals of more and great SBHCs. Senator Stabenow has been a longtime champion of school-based health centers. As many of you know, she was the force behind the successful inclusion of $200 million in the Affordable Care Act for construction and renovation of school-based health centers. We honored her last year with our National Champion Award, and shortly after, her staff approached us with their desire to introduce a comprehensive SBHC bill. Another longtime SBHC champion, Congresswoman Lois Capps of California, will be introducing a companion bill in the House. This bill has several main components. It will strengthen payment from Medicaid and CHIP, make several technical improvements to the school-based health center authorization that was included in the Affordable Care Act but never funded, provides grants to state-based technical assistance resource centers, creates programs to support and expand the utilization of community health workers and telehealth services in SBHCs, and designates SBHCs as federal safety net and essential community providers. Community health workers are the first section of this bill. Community health workers, although not yet commonly utilized by school-based health centers, are increasingly being utilized as frontline public health workers. Community health workers are trusted members of a community and serve as a link between healthcare, social services, and the community. They help to increase the health knowledge and self-sufficiency of individuals, families, and communities through a range of activities such as outreach, community education, informal counseling, social support, and advocacy. The evidence base for the effectiveness of utilizing community health workers is growing, particularly in managing chronic conditions such as asthma and diabetes. This bill establishes a grant program to utilize community health workers as peer educators and coordinators of care to improve access and adherence to care plans administered in school-based health centers. They may also serve as a health educator, assisting students and their families in adopting healthy behaviors, helping to conduct needs assessments, and program monitoring and evaluation. Another growing mode of healthcare delivery, particularly in school-based healthcare, is telehealth. This bill establishes a grant program to provide telehealth services at school-based health centers, allowing for improved access for students in medically underserved areas. These funds can be used for new services or to expand pre-existing services. The funds provided by this program do not preclude the telehealth provider from being reimbursed by public or private insurance. Another key part of this bill is strengthening reimbursement for Medicaid and CHIP. This bill requires state Medicaid agencies to certify to the Secretary of HHS that they have implemented procedures for payment under Medicaid and CHIP for covered items and services furnished by SBHCs. Under state Medicaid plans, SBHCs must be reimbursed the same as items and services provided in a physician's office or outpatient clinic, including at the same capitation or risk-based rate of payment. The language in this section of the bill is taken directly from the Healthy Schools Act of 2009, a previous bill introduced by Senator Stabenow. As many of you know, school-based health centers were authorized in the Affordable Care Act, creating the first dedicated source of federal funding exclusively for the operation of school-based health centers. Unfortunately, this authorization has never been funded. This is separate from the $200 million for the construction and renovation of SBHCs, which was fully funded and dispersed. This bill makes several technical improvements to the authorization. The eligible sponsor list is expanded to include universities, accountable care organizations, and behavioral health organizations. This is to align with current school-based health center sponsor agencies and those who are projected to be possible sponsors in the future, allowing for greater access and diverse sponsor types. Telehealth and health education are added as an allowable service under this grant program for improved access for students in medically underserved areas. Under the evaluation section, language is added to acknowledge the current collaboration between the School-Based Health Alliance and the Maternal and Child Health Bureau on developing national quality performance measures for all school-based health centers, our National Quality Initiative. Monitoring and evaluation of grants made under this program will be aligned and coordinated with these performance measures. Lastly, state technical assistance resource centers are added. These are modeled after the state primary care associations, which were established to provide technical assistance to federally qualified health centers. These grants will create state-based entities or support pre-existing ones with the purpose of maximizing state and federal resources and policy to enable the development of school-based health centers and enhance the operation and performance of SBHCs. We see this as an opportunity to support and expand our state affiliates. The last section of this bill firmly establishes school-based health centers as part of the healthcare safety net by designating them as essential community providers. In the bill, the Public Health Service Act, Section 340B, and Qualified Health Plan and the Qualified Health Plan definition of an essential community provider are amended to include school-based health centers. Essential community providers include providers that serve predominantly low-income and medically underserved individuals. Section 340B status provides such benefits as access to low-cost drugs and tort protection. The marketplace qualified health plans must meet standards for inclusion of essential community providers in their provider networks, including a requirement that a certain percentage of ECPs in a health plan service area are included in contracts. So that is a summary of the bill. For more detail, we will make the bill summary and detailed section-by-section analysis available on our website. So what's next? We anticipate bicameral bill introduction later this month, but we do not yet have an exact date. We are planning congressional briefings on the House and Senate side for early March to highlight this bill. We will be asking you to reach out to your members of Congress to invite them to attend this briefing, as well as to sign on to the bill as co-sponsors. We want as many co-sponsors as possible, but in particular, those members who sit on the relevant committees of jurisdiction for this bill, which include the Senate Health and Finance Committees and the House Energy and Commerce Committees. We will be doing some targeted outreach to our field to get those members to sign on. So I am now going to pass it off to Kyle, who will discuss our advocacy tools. Thank you.
Great, thanks, Suzanne. So as many of you know, February is National School-Based Healthcare Awareness Month, so the timing of this bill is really perfect. So we'll follow up with more concrete instructions, but we wanted to give you a preview of what you can do during Awareness Month and beyond to build support for this bill. So let's start with our Advocacy Center, which you can find on our website underneath the Advocacy tab. In the Advocacy Center, we'll have a series of alerts that are currently active. Right now there's only one, but as the bill is introduced, we'll be adding alerts to this section, so you can use the Advocacy Center to ask your representatives and senators to co-sign or invite them to our briefing. And you do that by clicking the Take Action button under a current alert. That'll bring you to a new page that will have some more background information about the ask. And to start creating a message to send to your members of Congress, you just enter your zip code into the box at the bottom of the page. That'll bring you to this screen, which will include a draft of the message that we've populated in there, and it will show you below everyone who will be receiving this message. This can be edited, so if you want to personalize it in any way to put in any information about your state, you can do that. And whenever you're ready to send it, you would just fill in the contact information, which you can see to the right. This page also includes the phone number and the fax number for the office of your members of Congress, which can be helpful if you want to reach out and follow up on the email with a phone call. So that's really it for the Advocacy Center. Something that we'll also be asking you all to do during Awareness Month is use our mapping tool. So hopefully you've had a chance to check out the tool. You can use it to map counties in your state that are underperforming on a variety of indicators, and then show where the school-based health centers are located. These maps can be downloaded as PDFs. So what we'll ask you to do is send these PDFs directly to your member of Congress's health staffers. One of the limitations of the Advocacy Center is that it can only send text emails. You can't send attachments. So you really need to build relationships with the people on the Hill to be able to send these PDFs to them. So we'll have more information on that later in the month, including a training video on how to create these PDFs. And finally, during Awareness Month, I wanted to make sure that you were all aware that we're going to be holding a Twitter chat. This Twitter chat will be on Tuesday, February 23rd from 2 p.m. to 3 p.m. and it will focus on how SBHCs improve child and adolescent health. So please join us for this Twitter chat if you are on Twitter by using the hashtag SBHCmonth16. That's it for me, so I'll hand it back to Suzanne.
All right, thanks, Kyle. So we wanted to sort of make that quick and as efficient as possible because we anticipate that there will be some questions and we want to have a discussion. So let's go ahead and see if we have any. So, okay, so I'm looking at these questions. All right, I am just going to put this on mute for a second while I look at the questions on front of me. So while I look at all these questions that are in front of me in the chat tool and prepare my answers, I do want to let everyone know we have unmuted our policy consultants, Brooke Lehman and Megan Zuckerman. So Brooke and Megan, if either of you have anything that you want to add while I get these questions prepared, feel free to jump in.
Hi everyone, this is Brooke. Hopefully you can hear me.
I
just would like to reiterate the importance of this bill for everyone. Some of you on this webinar may have been around with us for quite some time and have seen the various iterations of sections of this bill as we've tried to pass them, as some of them have passed. But this is a tremendous opportunity for the field. It is a vision bill. We are asking for quite a lot in this bill, but bear in mind that the strategy is to put it all out there without reservation and then take pieces out of this larger bill as we think there are vehicles for those to pass. So certainly looking at the Medicaid section as things are coming through Senate Finance, we'll be working with Senator Stabenow on pulling out the Medicaid sections and trying to work those through. So you may look at the bill and think, how is any of that possible? But I'm trying to help everybody understand that it's something to be very excited about, and it is going to be doable. It's going to be doable in piecemeal, and we're just going to have to get excited and participate in each piece as we have the opportunity. Megan, do you want to say anything else?
I just wanted to say that we have created for you, which you'll receive after the call, an Excel sheet that matches up all of your states with your member of Congress that serve on the relevant committee for the different sections of this bill. So we will make this as user-friendly as possible, as easy as possible. We'll provide you with talking points, and as Brooke said, if you've been doing this with us for the last decade plus, then you know the drill. But we will absolutely provide you with everything that you need so that you can go out to and connect with your member of Congress and the staff of your member of Congress to get them to be a co-sponsor, to get them to attend the briefing, and you know, we'll just need a lot of help from all of you. But we have all the resources for you, so do not hesitate to call on us when needed.
Thank you, guys. Okay, so I'm looking through some of these questions here, and we're going to see if we can get some answers. So Brooke and Megan, I'm probably going to need your help on these. Okay, so the first question, does the Medicaid CHIP section alter states' ability to limit the types of services SBHCs can bill for? For example, in Maryland, Medicaid regulations prohibit billing for sports physicals. Brooke, Megan, you want to jump in on that?
So the way that I would understand that is that what we are looking for is equity. And so this will not necessarily impact state laws unless advocacy is done to do so. The intent of this provision is to ensure equity among providers so that school-based health center providers are being reimbursed as any other provider offering services that are reimbursable. Now, that your state doesn't reimburse for school physicals is odd, but I don't think that this would do anything to change that. This would just create a federal mandate that the state reimburse school-based health centers for covered services delivered to covered children. Does that make sense?
I think, yeah, and it's sports physicals. I don't know if that was clear, but yeah, I think that that does make sense.
That our section will change the sports physical piece for a state.
Okay.
And the language in the bill is very specific that the state implements procedures to pay for medical assistance. And then when you refer back to the sections of what that medical assistance is, it's EPSDT.
Okay.
So too much detail to get into now, but I'd be curious as to why the state is not paying for sports physicals. But I understand that that's a conversation for a different day.
Okay. Okay, next question. Does the Affordable Care Act component about health education being an allowable service mean that community health workers or nurse education through the SBHC would be billable?
Yes.
Okay.
So the idea is that there would be a grant program available to establish an employee to serve the purpose of a community health provider. Now, based on based on the services that that individual provides will determine whether or not those services are billable. But increasingly, services delivered through community health providers or whatever they may be called in different states are in fact reimbursable.
And the way that I understand the question is that it was connected to the authorization, which was passed in the ACA. So that is also a grant that you'd be applying for your SBHC to receive the authorization money. And that would, if for a health educator, that would be something that you would itemize in your grant.
Okay. I'm looking at a question here around FERPA and HIPAA compliance. So much outcome data is blocked with FERPA and HIPAA compliance issues, especially when you put school performance data and health outcomes. Is there any provision in the bill to assist us in setting up outcomes that support the link between academic success and school health services, especially if we are expanding to include community health workers? So the short answer to that is that we don't have anything in this bill around FERPA and HIPAA. Brooke, Megan, do you want to speak a little bit more to that?
I would just say
I think it's important that we continue that conversation after this call with whoever the question came from, so that we make sure we're fully aware since the bill will be taken apart in pieces. Let's make sure that we are up to speed on what exactly is needed, because as Suzanne said, there is not a provision in right now for FERPA or HIPAA.
And I would just add that what you're going to see in this bill in particular is fairly broad language, knowing that ultimately each piece is going to be taken out and worked into greater detail and then attached to something else. So again, just echoing Megan, we'd love to hear more about that, but a lot of the detail is not going to be found in the actual legislative language that we have currently. It's either going to come when the section is teased out more or through the regulatory process should we be able to get a piece passed.
Okay, and somebody asked, will the bill allow for a mental health school-based clinic? So I think So, and Brooke and Megan, correct me if I'm wrong, but in the authorization piece, a clinic that is just doing mental health would not meet the criteria for what we consider a full school-based health center. So there would have to be primary care services provided as well. It would not fund just a standalone mental health services clinic in a school. Is that correct, Brooke Megan?
Yes.
Okay. All right. Okay. All right. I think I've gotten a few more questions from folks that want to chat more offline and get into detail about some of these things. So we are happy to do that. We will save all of your questions here and be sure to follow up with you offline. If anyone has any other questions that we've not gotten to, please type them in the chat box so that we can get to them.
I just wanted to make a point to the last question. So we have added in the authorization section, we've added that behavioral health organizations can be a sponsoring organization. So if that question was alluding that the sponsoring organization can be behavioral health organization, but as Suzanne said, they would also have to be providing the full range of services, which does include primary care.
Right. Right. All right. Any other last thoughts, Brooke or Megan, before we jump off?
So know that
I would just say that we're looking forward to this month, that we're looking forward to the introduction of this bill, and we hope you all will join us in the work ahead of trying to get support for it, and that will include doing the briefing. And I think many of you have been through this process with us before, but we're happy to be back and working with you all, and thanks for even joining today to learn more.
I know what Brooke said, and just wanted to add that you'll be receiving a lot of communication from us. So please let us know if you have any questions and follow up. Please read everything, and we really look forward to working with you on this. This is a monumental bill.
Thank you both for joining us and answering questions. And thank you everyone for participating in this webinar. As Brooke and Megan said, we will be following up with you and really engaging you to move this bill forward. So appreciate you all participating on this, and we will talk with you all soon. Thank you.